lumbar region where the kidney is located, which is known as flank pain. And along with flank pain and fever, patient may have all the symptoms that has been described in when the patient was having infection of lower urinary tract. That is, along with during the upper urinary tract infection, along with fever and flank pain, patient may also have dysuria, increased frequency of micturition, burning micturition, and increased need to pass the urine, and uh, and feeling and pain also. So these are the symptoms of urinary tract infections. And the most common cause of urinary tract infection is most common causative agent of urinary tract infection is E. coli. So E. coli is the most common organism that may cause urinary tract infection, but sometimes certain bacteria and fungus can also cause urinary tract infection, but the most common organism is E. coli. And urinary tract infection is most common in females as compared to the males because female has a short urethra as compared to males. Due to the short urethra, what happened? There is shorter distance for bacteria to enter into the bladders. That's why the um, female are more prone to cause urinary tract infections. And other causes of urinary tract infection may be due to some anatomical defect in the uh, urinary tract, that is abnormal urinary tract system, or maybe due to some blockage in the urinary tract, either due to uh, ureteric stone or kidney stone present in it, and it may block the flow of the urine and patient may have urinary tract infection. And it can also have a patient can also have urinary tract infection when in case of prostatitis or when there is enlarged prostate, especially in case of old age males. And it is also common in immunocompromised patient. And urinary tract infection is also common in those patients who are in catheter. So those patients who are unable to pass urine, who has enlarged prostate, those patients will be having catheter. So those patients who use catheter for longer duration of time can also get urinary tract infection. And it is also common in those patients who has recently undergone any urinary procedure or having some instrumentation done in the urinary tract. So these are the most common causes of urinary tract infection. And coming to diagnosis, how do you diagnose the UTI? Normally, the history of the patient itself signifies the urinary tract infection. Like symptoms and signs of urinary tract infection itself will define that the patient is having urinary tract infection. But to confirm it, you have to do routine urine urine routine and microscopic examination. If the patient is having urinary tract infection, in routine routine microscopic examination of urine, you can see plenty of pus cells in the urine examination. You can see the findings there that there is lots and lots of pus cells present in the urine, and so you can treat the patient accordingly. And you can also find the causative organism by doing the urine culture. So when you do urine culture, you can see presence of E. coli or other bacteria or fungus present in the culture report. And after seeing the urine culture and sensitivity reports, you can prescribe the relevant antibiotic to the patient. So this is all about urinary tract infection. Now let's go into the urinary antiseptic, that is treatment of urinary tract infection. So urinary antiseptic, these are the oral agents that has an antibacterial activity in the urine only. So urinary antiseptics are those oral agent that has antibacterial activity only in the urine. It does not have uh, any systemic antibacterial effect. So This urinary antiseptic will act only in the urinary tract, or it will have its antibacterial activity only in the urine, but it will have no antibacterial action on the system. So other systemic infection cannot be treated with urinary antiseptics. So the definition is the urinary antiseptics are those oral agents that exert antibacterial activity only in the urine but have little or no systemic antibacterial effect. And these urinary antiseptics are usually useful for the treatment of lower urinary tract infection only, not for the upper urinary tract infection. So its usefulness is limited to lower urinary tract infection only. So what are the drugs that comes under urinary antiseptics? Basically, there are three drugs that are used as an urinary antiseptics. Number one is nitrofurantoin, number two methenamine, and another is nalidixic acid. Now, so let's talk about nitrofurantoin. So nitrofurantoin basically it is a bacteriostatic drug. Okay, it's not a bacteria sorry it is a bacteriostatic drug, and it may be bactericidal at higher concentration. So basically it has bacteriostatic action, but at higher concentration only nitrofurantoin can exert its bactericidal effect, and it has bactericidal effect in acidic urine because its activity is enhanced at lower pH. So nitrofurantoin basically it is a bacteriostatic drug, but it can have bactericidal action when it is used at a higher concentration, and when it is in the acidic urine, because in acidic urine its activity is enhanced or its activity is increased in the acidic urine that is at lower urinary pH. And this nitrofurantoid, its activity is limited to E. coli. So it can treat the urinary tract infection that is caused by E. coli. Coming to mechanism of action, so when we take nitrofurantoin, the sensitive bacteria will enzymatically reduce the nitrofurantoin to its active form, and it will inhibit various enzymes, and then it will damage the DNA of the bacteria, and it will affect the protein synthesis. So when nitrofurantoin is taken, the bacteria will enzymatically reduce the drug into its active form, and there will be damage to the DNA of the bacteria, and there will be inhibition of protein synthesis. So it will inhibit the synthesis of protein, and it will damage the DNA of the bacteria by converting it into the active form. And nitrofurantoin, it will antagonize the bactericidal activity of nalidixic acid. So it will have the opposite effect of that of nalidixic acid. Coming to pharmacokinetics, so nitrofurantoin, they are well absorbed orally, they can be taken orally, and they are rapidly metabolized in the liver and also in other tissues, and less than half of it is excreted on change in the urine, and T half of nitrofurantoin being 30 to 60 minutes, and its antibacterial concentration is not attained in blood or tissue. So it's nitrofurantoin, as I had already told, it has an antibacterial action only in the urine, but it doesn't have any antibacterial action on tissues or blood, or it doesn't have any systemic antibacterial activity. And this drug should not be used with probenecid. It is a drug which is used in treatment of uric acid, isn't it? So it should not be given along with probenecid. It should not be used in azotemic patient because it will interfere the tubular secretion of this drug. Coming to adverse drug reaction. So nitrofurantoin, it causes gastrointestinal intolerance causing nausea, epigastric pain, and it may cause diarrhea. These are the most common adverse effects that is seen when we use nitrofurantoin. And it may also cause hypersensitivity reaction like fevers and chills, and it may cause peripheral neuritis along with other neurological effect if it is given for longer duration of time. And it may also cause hematological disorder like leukopenia, granulocytopenia, and also it may cause hemolytic anemia in G6PD deficiency patient. And it may cause liver damage, it may cause pulmonary reaction with fibrosis or chronic use. So if nitrofurantoin is used for longer duration of time, it may cause damage to the liver and lungs, and it may also cause fibrosis of the lung. And those patients who are taking nitrofurantoin, when we expose the urine of that patient into the ear, what will happen? The urine of the patient taking nitrofurantoin will change the color into dark brown color. So, and this nitrofurantoin, it is contraindicated in patient with renal failure, and it is also contraindicated in pregnancy and neonates. So basically, it has an adverse drug reaction like gastrointestinal intolerance, hypersensitivity reaction, peripheral neuritis, hematological disorder, and liver damage and pulmonary fibrosis in chronic use. And when the urine is exposed to the air, then it will turn into dark brown color. Now uses. So it is used for treatment of uncomplicated type of lower urinary tract infection which is not associated with prostatitis. So it is basically used for uncomplicated type of lower urinary tract infection. And it is also used for suppressive long-term treatment of chronic lower urinary tract infection. If the patient is having chronic lower urinary tract infection, it can also be used to treat that, and it can also be used for long-term prophylaxis of UTI. So uh, we can use this drug for prophylaxis of UTI. Like if we are doing catheterization to the patient, we can use nitrofurantoin for prophylaxis because catheterization itself can cause urinary tract infection. It is the source of UTI. And if the patient is going to have some instrumentation done on the urinary tract to prevent the urinary tract infection, it can be given as a prophylactically. And in women with recurrent cystitis, and if the patient is female patient is having recurrent history of cystitis, that is recurrent history of infection of the bladder, we can give nitrofurantoin prophylactically in these patients. Now coming to another drug, that is methenamine. So methenamine, it is a prodrug. So as you all know, prodrug is an inactive form of drug which is converted into active form after being metabolized. So methenamine, it is a prodrug. It decomposes slowly in the acidic urine to release formaldehyde. So slowly this drug will be decomposed in the acidic environment of the urine, and it will release formaldehyde, and this formaldehyde will inhibit all the bacteria that cause urinary tract infection. So it will slowly decompose into acidic urine to form the formaldehyde, and this formaldehyde will inhibit the growth of all the bacteria. And like mm, nitrofurantoin, it also doesn't have any antimicrobial activity in the blood as well as tissues. And this drug methenamine, it needs to be administered with mandelic acid or ascorbic acid. So why ascorbic acid or mandelic acid has to be added along with methenamine? Because methenamine, it will show its action in the acidic urine. If the urinary pH is more, the methenamic acid effect will not be that relevant. So to have the potent action of methenamine, we have to make the uh, pH of the urine less, that is acidic. So that's why we use mandelic acid or ascorbic acid, as acidic urine is needed for the action of methenamine. So we have to have the pH of 5.5 or less for methenamine to act. And methenamine, it is administered as an enteric coated tablet. It is enteric coated tablet. So it is administered as an enteric coated tablet to protect it from decomposing in the gastric juice. So gastric juice may uh, damage the action or prevent the action of methenamic acid. So to prevent the decomposition by gastric juice, it is always given as a enteric-coated tablet. So methenamine, it is given as a methenamine mandylate, and it is excreted in the urine. And when it is in the urine, it will lower the pH of the urine and promotes decomposition of methenamine, that is, lower urinary pH itself disfavor the growth of urinary pathogen. So it is given as an enteric-coated tablet in the form of methenamine mandylate, and it is excreted in urine, and it will lower the pH of urine, and it promotes the decomposition of methenamine. So whenever the urinary pH is less, it will disfavor the growth of urinary pathogens. And methenamine, it is used for chronic and resistant type of urinary tract infection not involving the kidneys. So basically it is used for treatment of lower urinary tract infection, which is chronic lower urinary tract infection or resistant type of urinary tract infection. But it is not effective for acute urinary tract infection, and it is also not used for the patient. Uh, it is also not used for catheterization prophylaxis as in case of nitrofurantoin. Uh, this methenamine, it causes gastritis because it releases formaldehyde in the stomach, and this formaldehyde, it is the cause for causing gastritis in the patient, and it may also cause chemical cystitis, and it may also cause hematuria if it is given at very higher dose and if it is given for longer duration of time. So if methenamine is given for longer duration time, and if it is given at a higher dose, it may cause chemical cystitis and hematuria, and sometimes it may also cause central nervous system symptoms like dizziness, headache, etc. Now coming to another drug, that is nalidixic acid. So nalidixic acid, it is a non-fluorinated type of quinolone, and it has a bactericidal action. So it inhibits the replication of bacteria by interfering with the action of DNA gyrase during bacterial growth and development. So it will interfere the it will interfere with the replication of the bacteria, and it will interfere the action of DNA gyrase, which is needed for the growth and development of the bacteria. And this nalidixic acid, uh, it usually develops resistance very rapidly. So it is not commonly used nowadays, and it is a second drug of choice for treatment of urinary tract infection. And there may be history of recurrent, if the patient is having recurrent history of UTI, we can use nalidixic acid. And nalidixic acid is not that commonly used as nitrofurantoin, and we can use nalidixic acid depending upon the report, that is culture report. Okay, culture, in what happens in the urine culture, we can see the sensitivity report in the culture. So depending upon the sensitivity report, we can use nalidixic acid. If the organism is resistant to nalidixic acid, there is we cannot use the nalidixic acid. But if certain organism, if it shows sensitivity to nalidixic acid, then we can use it. So depending upon the sensitivity report, we can use nalidixic acid for the treatment of urinary tract infection. And as an adverse effect, it may cause GI upset, rashes, headache, drowsiness, vertigo. It may also cause visual disturbances, and it usually causes seizure in the patient. That's why nalidixic acid is contraindicated in infants and children because it may cause seizure. and there may be history of nausea, vomiting, or abdominal pain, and there may be history of photosensitivity, urticarial rashes, as well as fever. Now coming to another drug, it is phenazopyridine. So it is not urinary antiseptic, but it is a urinary analgesic. So name itself explains it. Urinary analgesics, it will decrease the pain. Okay, so it is a urinary analgesic. It is an orange dye and it exerts analgesic action on urinary tract. So this drug, it will decrease the pain that occurs during urinary tract infection. So it offers symptomatic relief from burning micturition. So patient will have history of burning micturition which is extremely painful, and patient may have dysuria, that is patient may have pain while passing urine. That is also when this dysuria, during dysuria patient will have pain while passing the urine, but mostly it is painful at the end of maturation. So patient will pass urine, and at the end of maturation patient will have extreme pain, and patient will also have urgency of passing urine. So these symptoms can be reduced by using urinary analgesics. So, and this urinary analgesic, it has only analgesic property, it doesn't have any antibacterial property, and as an adverse effect it can cause nausea and epigastric pain. So to reduce the pain that occurs during urinary tract infection, you can use urinary analgesics as well. Now urinary tract infection treatment. So how do you treat urinary tract infection? So mostly urinary tract infection are caused by gram-negative organism, and usually acute infection are caused by single organism, that is E. coli. So E. coli is the most common organism that cause urinary tract infection. But chronic and recurrent infection, these can be caused by these are the mixed infection. This can be caused by bacteria, viruses, fungi, or other organism. So acute infection are usually self-limiting. It may resolve by itself. And acute infection, in acute infection, if there is high urine flow rate and if there is a frequent bladder voiding, it can be resolved itself. If during acute infection, if we drink lots and lots of water and we flush the urine, like if there is high urine flow rate after drinking lots of water, it may cause flushing of the urine, and acute infection may resolve by itself. Okay, and for treatment of lower urinary tract infection, usually single dose antibiotic are used, or usually 3 days regimen of antibiotic can be used for treatment of lower urinary tract infection. But for upper urinary tract infection, the treatment should be more aggressive, because in upper urinary tract infection there may be there is involvement of kidneys. So to prevent the patient from having kidney failure, the treatment of upper urinary tract infection should be more aggressive, and treatment is needed for a longer duration of time as compared to that of lower urinary tract infection. So bacterial investigation are important to choose the right drug. So we have to choose the right drug, we need to have the proper investigation, and urine sample must be collected before starting empirical therapy. Sometimes what happens, patient will have all the signs and symptoms of urinary tract infection, and patient is in extreme painful condition. Patient may have very high grade of fever with pain. So we can start the treatment empirically. Okay, and what do you know what is empirical treatment? It is a therapy which is based on the clinical experience, and after seeing the signs and symptoms that matches with the urinary tract, we can start the treatment empirically. We can give antibiotic empirically without waiting for the investigation report. But before starting any antibiotic, first we have to have the urine sample collected. First we have to take the urine sample, and then we can give it to the lab, and we need not to wait for the report of urine sample to come. We can just start the antibiotic empirically, and then after 2 to 3 days, when urine culture report comes, we can then see the report, and according to the sensitivity report, we can after seeing the urine sensitivity report, the antibiotic which we have been giving to the patient, if it's sensitive through that organism, we can continue with that antibiotic. If culture report shows that the antibiotic which we have been using is resistant to that organism, then we can change the drug later on. But we can start the treatment empirically. But before starting antibiotic, we need to have urine sample collected. And uh, how do you collect the urine sample? So we have to have the sterile method for collecting the urine sample, and we should always take the mid-stream sample of the urine. So patient is asked to void the urine. So first part of the urine is discarded, and the middle part of the urine sample is taken, which is known as mid-stream sample. So we have to take the mid-stream sample of the urine collected. Okay, and then usually smaller than usual dose may be effective for the treatment of lower UTI. So whenever we treat lower urinary tract infection, smaller dose of the drug is effective, as most antimicrobial agents they attain high concentration in the urine. But while treating the upper urinary tract infection, it requires larger doses as for any other infection, and least toxic and cheaper drugs should be chosen for and for proper duration of time. So whenever we prescribe any antibiotic to patient, it should we should keep in mind that it should be least toxic to the patient, and it should be cheaper as well, so that all the patient can afford the drug uh, properly, and select the drug that does not disrupt the normal gut and perineal flora. And if frequent recurrence history of frequent recurrence is there, then chronic suppressive treatment is given with antibiotic like cotrimoxazole, nitrofurantoin, cephalexin, norfloxacin, etc. So status of antimicrobial agent other than urinary antiseptics in UTI. So, urinary antiseptics are used for the treatment of urinary tract infection. So, along with other than urinary antiseptic, we can use other antimicrobial agent as well for the treatment of UTI. So, among them is cotrimoxazole. So, cotrimoxazole it is employed empirically in acute urinary tract infection. Cotrimoxazole it has a broad spectrum of uh, action. So it is used for prophylaxis of recurrent cystitis in women. So in women which is having recurrent infection of the urinary bladder, it can be used prophylactically, as well as it can be used prophylactically in the patient who is catheterized. So before catheterizing, we can use cotrimoxazole prophylactically to prevent the urinary tract infection which may occur few days after catheterizing the patient. And cotrimoxazole can also be used for the treatment of prostatitis, that is the infection of prostate gland, and it is contraindicated to use in treatment of urinary tract infection during pregnancy because it may have teratogenic effect to the fetus. Coming to another drug, that is quinonones. The first generation fluoroquinolone, especially ciprofloxacin and ofloxacin, are highly effective. So for the treatment of urinary tract infection in clinical practice, we have been using ciprofloxacin and ofloxacin most commonly for the treatment of urinary tract infection. So it has this quinolone, they has low cost, they are very they can get uh, they have low cost and has potent action against gram-negative bacilli, and it is useful in complicated cases of prostatitis. It is also useful in the patient who has indwelling catheter, that is patient who has been using catheter, and for bacteria which are resistant to cotrimoxazole and ampicillin. So it is useful in case of prostatitis, in useful in those patients having catheter, and it is useful for the bacteria which are resistant for cotrimoxazole and ampicillin, but fluoroquinolone should not be given to pregnant female because it has teratogenic effect in the fetus. Ampicillin and amoxicillin. So ampicillin and amoxicillin were used in the past. These drugs were frequently used in the past as a first choice of drug for acute infection. But nowadays, usually ofloxacin and ciprofloxacin are most commonly used. But before, ampicillin and amoxicillin were considered as a drug of choice for the treatment of UTI, and it since it has higher failure rate and higher relapse rate, so it is unreliable for empirical therapy. And nowadays amoxicillin plus clavulanic acid as a combination, it is used for treatment of urinary tract infection. And parenteral amoxiclav is often combined with gentamicin for initial treatment or for treatment of acute pyelonephritis. So, if ever ampicillin or amoxicillin has to be given, it is given in combination with clavulanic acid, and if it is given parenterally, it is combined with gentamicin for the treatment of acute pyelonephritis. Another drug, piperacillin and ticarcillin. These are the drugs which are used for serious pseudomonas infection in the patient who are in indwelling catheter. So, if UTI are caused by pseudomonas infection in those patients who are in catheter or in those patients having chronic urinary obstruction and in those patients who are hospitalized, and this drug can also be given depending upon the sensitivity report. And another drug is cephalosporin. So cephalosporin, it is increasing use especially in nosocomial, Klebsiella and protease infection. So what is nosocomial infection? So nosocomial infection, it is a hospital acquired infection. So when the patient is in the hospital and during the treatment course, patient develop infection, that is the nosocomial infection, which is also known as hospital acquired infection. So it is used in nosocomial, Klebsiella and protease infection, and treatment is employed on the basis of sensitivity report, and it is used empirically for community acquired urinary tract infection. So community acquired infection is the infection manifesting and diagnosed on 48 hours of admission in patient without any previous encounter with health workers. So community acquired infection are those infections which occur in the hospital, and it is usually diagnosed within 48 hours of admission into the hospital, and patient doesn't have any previous history of exposure to any healthcare worker. That is a community acquired infection. So it can be used for the treatment of community acquired urinary tract infection. And when cephalexin it is given once daily for prophylaxis of recurrent UTI, especially in women likely to get pregnant. Coming to gentamicin, it is sensitive against pseudomonas infections. So if UTI are caused by pseudomonas infection, we can use gentamicin. It has narrow safety of margin, and it is usually given through parenteral route, and we have to wait for the culture report to see the sensitivity of the organism to gentamicin before starting it. So gentamicin has to be started only after seeing the urine culture and sensitivity report. Now, what is the role of urinary pH in relation to the use of antimicrobial agent? So as I have already told that for the action of methenamine, the urine should be acidic, isn't it? The pH of urine should be low, that is acidic urine is required for the action of methenamine. And in case of inadequate response, as well as in case of complicated cases, measurement and correction of urinary pH should be attempted. If the patient is having UTI and if patient has been treated with antimicrobial agent, but patient is not showing any adequate response. Yes, so in that case we have to see the level of pH in the urine, and it has to be corrected accordingly. And in case of urease positive protease infection, drug those act at higher urinary pH should be used. So favorable urinary pH for antimicrobial action like nitrofurantoin, methenamine, and cloxacillin, they have increased activity in the acidic urine, whereas cotrimoxazole, aminoglycoside, and fluoroquinolone has increased activity in alkaline urine, whereas chloramphenicol and ampicillin, this drug doesn't have any, the treatment doesn't depend upon the pH of the urine. Okay. Now, antimicrobial regimen for acute urinary tract infections. So, how do you treat and what are the drugs that are used for the treatment of acute urinary tract infections? So, usually all the acute urinary tract infection can be given for duration of 3 to 5 days. So, we can use norfloxacin, ciprofloxacin, ofloxacin, cotrimoxazole, cephalaxin, cefodoxime, amoxicillin, clavulanic acid, and nitrofurantoin. But most commonly in clinical practice, we have been using ciprofloxacin, norfloxacin, and ofloxacin commonly. So ciprofloxacin, it is given in a dose of 400 milligram twice a day, norfloxacin, and ciprofloxacin, it is given uh, 250 to 500 milligram twice a day, ofloxacin 200 to 400 milligram twice a day, cotrimoxazole 960 milligram twice a day, cephalaxin 250 to 500 milligram 4 times a day, that is 6 hourly. Cefodoxime, it is given 200 milligram twice a day, whereas amoxiclav, it is given 3 times a day, that's 8 hourly. And nitrofurantoin, if we use, it is given in a dose of 100 milligram twice a day, and it can be given for 3 to 5 days or for 5 to 7 days. And along with antibiotic, we have to tell the patient to drink lots and lots of water so that the urine can be flushed out. So if the patient with renal impairment is having urinary tract infection, then how are you gonna treat? So urinary infection in patient with renal impairment. Usually renal failure patients are difficult to treat because they are already having kidney problems, so they have, it's very difficult to treat them. And there are many drugs which are contraindicated in case of renal failure, and there are many antibiotics which may cause renal failure, so it should be treated very properly. So these are the drugs which are contraindicated in case of renal failure, that is methenamine mandolate cannot be given to the patient having UTI with renal failure. Tetracycline and cephalosporin are contraindicated, and drugs to be avoided are nitrofurantoin, nalidixic acid, aminoglycosides, and potassium salts and acidifying agent can be contraindicated. We can use third generation cephalosporin, that is ceftriaxone, can be used for the treatment of urinary tract infection in patients with renal failure. We cannot give aminoglycosides in case of renal failure patient because it itself cause renal failure. So we can use third generation cephalosporin, that is ceftriaxone, to treat urinary tract infection in patient with renal impairment. Now coming to prophylaxis for a urinary tract infection. So what are the conditions where we give antibiotic prophylactically? So prophylaxis can be given when women of childbearing age have recurrent cystitis. If the patient female is having recurrent history of bladder infection, for that patient we can use prophylactically antibiotic. We can treat patient prophylactically, and catheterization or instrumentation inflicting trauma to the lining of the urinary tract is performed. So what happens? Usually while catheterization, if it is not catheterized properly, or whenever there is some instrumentation procedure done in the urethra, especially in the male patient, there may be trauma in the lining of the urinary tract. So whenever there is trauma, bacteriemia frequently occurs, and injured lining is especially susceptible for the bacterial infection. So if there is catheterization being done, or if there is instrumentation, if there is planning of instrumentation to be done in patient, we can use prophylactical antibiotic to prevent the future urinary tract infection. And if there is indwelling catheter place, if the catheter had placed in the patient from long time, we can use prophylactic antibiotic. If there is uncorrectable abnormalities of the urinary tract present in the present, we can use prophylactic antibiotic. And in case of inoperable prostate enlargement or other chronic obstruction causing urinary status. So in certain patients where there is increase in the size of the prostate, there is, if there is prostatomegaly and the patient is having chronic illness, and if the patient is not being able to be operated because of some other chronic illness in the old age patient, so to treat the so to prevent from urinary tract infection, we can use antibiotic. And for other chronic condition that causes urinary status, or if the if due to other chronic obstruction patient is having difficulty in passing urine, in that case we can give prophylactic antibiotics. So that's it for treatment of urinary tract infection. I think everybody has understood. If not, you can ask me question later. Okay. Okay. Thank you.
Thank you, ma'am.
Thank you, ma'am.